Christine Schindler, and I'm the co-founder and CEO of Pathspot. My background is in biomedical engineering and global and public health. And I was first involved in research, working on in the developing world, working on projects to bring medical tools and technologies to resource-constricted settings, especially working on low-cost cancer detection tools and technologies. And I'm very passionate about global and public health issues. And when I returned to the US, I started to see so many discrepancies that were public health issues here domestically as well, that I felt like could really benefit from low cost but medical grade technologies and tools and systems that were being utilized in our hospital being brought to these other types of issues and problems. And one of them at the time was this huge issue of foodborne illnesses in restaurants. It felt like every time you turned on the TV, people were getting incredibly sick, hospitalizations, and even deaths from these harmful outbreaks. And when I started to dive deeper into those issues, I found out that the core root and most common reason that these contaminants were being spread and that these outbreaks were happening was because of poor hand washing practices. And I thought, it's crazy that the best practice solution right now are these signs we all know. Employees must wash hands before returning to work. I felt like as a biomedical engineer, it was time for a technical solution and something that could actually get to the root of this hand washing problem. We make a kiosk style device that mounts on the wall next to hand washing sinks in the back of house of restaurants, farms, packaging facilities, cafeterias, really anywhere where food is handled, stored, or served. And right after a team member or employee washes their hands, they put them underneath the device, flip them over, and it instantly pops up on a screen on the unit and says either green, you're all clear, or red, you need to rewash. And it takes less than 2 seconds, and then they can continue on their day knowing that their hands are clean. So the product uses visible light fluorescent spectral imaging to do the detection. It's looking for the host vectors that carry these harmful illnesses. And essentially, it autofluoresces them using a unique series of wavelengths from different LEDs and bandpass filters and a custom algorithm that we created on the unit. So the light autofluoresces the contaminants that are completely invisible to the human eye, and our unit is able to identify if they're present on the hand. And then we can actually take that information and feed that back to the restaurant team members so that we make really custom generated trainings and can say, hey, 98% of the time someone failed a hand wash, it was on your right pinky fingernail. Like, you really need to make sure to wash in that area. And we can isolate, where these contaminants hide. It's super interesting because when we take that data and actually even share it back to the general public, people don't know and don't realize all the spots you've got to wash when you're washing your hands. Our product is pretty unique. I think that, the most common competitor is the sign, employees must wash hands or trainings. And I think the validation around hand washing and hygiene is definitely something that people are really looking for. There's some options to have timers mounted on the sink or reminders for team members. But I think that gets back to the root of, you're not actually validating that the hand wash is done appropriately, the right number of times, and also effectively the right way, and that those contaminants are actually gone. That detection capability is what really sets us apart from a lot of the other tools and technologies that could be utilized to help support hand washing and support hygiene. So we charge our partners on a monthly recurring fee that encompasses the unit itself, all the detection and verification capabilities, as well as all of the data and our team's support in building that hygiene culture from the data analytics tool that we offer in a 24/7 data dashboard and platform that can be accessed from anywhere. So all of that is encompassed into a monthly platform for our locations. Typically for a location, it's around $150 a month to outfit their location with the unit. We've worked really hard to make it as affordable as possible for our partners, understanding that this is an industry that needs to make these tools accessible and approachable for across the board in their location and also to their bottom line. So right now we work with over 500 locations that are actively scanning. We have millions of hands that are being scanned constantly, and we have active users across all of those different locations, usually 40 or 50 team members per location. So we definitely have, a consistently growing user base of people that are operating with the product on a day-to-day basis. Our vision for the technology was always to scale far beyond looking for these foodborne illness bacterium in restaurants and in food service operations, to expand to be a health and wellness platform and detection system at large. When I look at public health and the impact that we have as we shift towards a preventative care model, you can't prevent if you can't detect. If you have no idea that this is there, we're not really getting to the root of the problem. And so I really believe that tools like this being implemented, especially during this time, is something that allows for us to create a healthier world across the board.